So it didn't change at all. It just kind of showed me that I knew exactly what I wanted to do. I either wanted to do ICU or the emergency room. Eventually I learned the emergency room does not have a lot of patient care. It was just kind of, you pump them and dump them. That's what they say. You pump them with IVs and you dump them off on a floor. I like ICU because it is bedside nursing. You are there through the nitty-gritty of everything. And through school, I love pathophysiology. I'm a nerd. I love to see the body systems just all go haywire, which is kind of weird, but I love, my mind works better under stress, and I love the challenge. I love to be there for patients when they're scared, and I can offer that encouragement for them. I love the families because they have no clue what's going on, and it's scary for them, and I love just being able to just calm the storm in the room while also my mind's still a storm running around trying to figure all this stuff out. But I feel I come alive. I come alive there. I'd be bored anywhere else. So the different areas of nursing, the common goal is that we all care for our patients. I mean, nursing is a niche that's special to different people. You have to have a calling into this. People don't just do it on a whim. And so having that compassion and that calling is something that just blends us all together, that we are there for patients and families. We love what we do, and having that common denominator is what kind of unites everyone together. The unique part of it is that everyone has their different skill sets and specialties and what they're good at, and you find what works best for you. Like for example, like ICU makes me come alive. If I was an OB and peds, I would hate it. I would be so bored, and I don't think I'd be very good at it because it's not something that I would like to do. And so finding that special skill and where you need to be is where you're going to thrive.
Yeah, so when I first started nursing school, I had my mindset on being a nurse anesthetist. That was what I wanted to do. And I shadowed nurse anesthetist, and I quickly realized it was boring to me. I did not like the sleeping patient. But I always knew I wanted to work with kids. My personality is quirky, and it doesn't necessarily jive well with adults in a vulnerable setting. So I always knew I wanted to do peds, and then I thought I was going to definitely do neonatal intensive care. I wanted to be an ICU nurse and go on and get my degree and be a neonatal nurse practitioner and an NP. But then when I graduated nursing school, pediatric hospitals were on hiring freezes and laying off. So I did 6 months of home care, and then I found myself getting a job offer at Children's on the float team. And I thought I'm going to do my year of float team, and I'm going to transfer to the NICU. And then I found out that I just love pediatric nursing in general, and I liked having the wide range of populations from the itty-bitty babies in the NICU to the teenagers that are angsty, come into the ED and are just irritated because they have an appendicitis. I loved working with all ranges and ages and different diagnoses, and so I've been on the float team for 8 years now at Children's, and have loved every population, every area I go. So in my introductions, I have kind of an eclectic collection of degrees and certifications. So what made me want to get my master's in nursing education was that I found myself loving working with nursing students at the bedside. And I got my preceptor certification at Children's and loved working with the new nurses. And I was like, I want to learn more about adult learning theory. And so because I love school, I went back to school and got my master's. Now, as I'm in my doctoral program, getting my DNP in nursing informatics, I really was intrigued by how do we use technology at the bedside, and how is that data that's generated influence what we do, or how we influence practice through data, which when I was an undergraduate, I hated data, I hated stats, I hated everything to do with that sort of a thing in research. And now I find that as I've been practicing, I go, where's the data behind what I'm doing? And I want to be responsible for helping find that data and convey that data so that we can improve practice for our patients at the bedside. So as a float team nurse, I get a unique perspective on this within Children's. So I mean, we have all of our different units. We have our neurology unit, our neurosurgery, we have our ICU, we have endocrinology, and we have our neonatal ICU and our pediatric ICU. And they're all very different, and there's all very different personalities of nurses that work in those areas. From the pediatric ICU, where nurses are very type A and very, very regimented, and the NICU is the same, to medical surgical, where things are a little more loose, and then the ED, where anything goes at any given time. But the common theme there is we all care about our kiddos and how we provide care to their families. And when I take a step back and look at nursing as a whole profession, again, going back to that nursing science is a sacred science, we all care for our patients, and how we care for our patients just differs based on the population and the culture and the work area that we are. But I think the underlying theme is a desire to provide the best care, and that care can look different from public health to the bedside to a critical access hospital out in the boonies of Minnesota, but it's all about caring.
So when I was at the beginning of my nursing career, I wanted to be an ER nurse. And I think that the reason I wanted to be an ER nurse was because I wanted to know how to stabilize every situation and meet everyone's critical needs. And I think in my mind, the reason I wanted to do that was because I wanted to know that no matter what walked through the door, I could handle it. But I think over time, after I had been exposed to a lot of those different ER situations, God really led me into being a midwife. He really did. He gave me opportunities in the OB units around my area that it felt, now that I look back on them, it just felt like He just opened opportunities up for me. And all I needed to do was have faith. But I didn't know it at the time. And so as these different OB experiences came open, I was surprised how many of my ER skills helped me even in OB. And so I'm happy that I had that background as I went into obstetrics, because there were still moments that I needed to use them, even as a nurse midwife and as a OB nurse. The reason that I advanced my degree, honestly, I think was God led. There was never a moment in my life that I thought to myself, I want to be a nurse midwife with a PhD. I can't think of a moment when I thought about that prior to becoming both of those things. I think it was organic. I think it was just taking one step at a time and hearing like God's call when the opportunity came. So just a little background for me, I started in a rural town as a nurse doing all of the specialties. And so I felt like I knew a lot about a lot of things, but was an expert in none. And then the opportunity came available for me to move into a high risk OB unit. And I brought those skills that I had from that rural hospital to an OB unit. And about 2 years after I was in that high risk OB unit, my husband got an opportunity, which was 3 hours from home, but closer to the University of Minnesota. And we moved for his job. Little did I know that God's plan was for me to go to midwifery school in the University of Minnesota, and our move as a family brought me closer to that university. And over time, as we raised our family, I kind of felt like I loved teaching. If I wasn't a nurse, I was going to be a teacher. And so with the variety of experiences that I had, it just made sense that I would do some teaching along with being a nurse. And so in order to be a nursing educator, they really encourage you to have a PhD or a doctorate degree. And so another kind of just fun little opportunity came along, and South Dakota State University was offering this PhD program. Most of it was virtual and online, and I could do it from a distance. And so I tried it and I went for it. And 5 years later, it all worked out. And I was able to go through school, take care of my family, and continue my job all at the same time. So as opportunities became available, I just took them, I guess. And I now see that God's plan was perfect, but I didn't see it at the time. So I think there are several different kinds of nursing, and I think different pieces of nursing apply to different populations or types of maybe floors that nurses work in. I'm thinking more of the larger hospitals, but nursing is important in every single one of those floors and in every single department. And so when I think about ER, I think nursing looks fast and maybe not really caring for a lot of the emotional needs of a client, but taking care of their physical needs and stabilizing them, which is a great profession. And we've all watched the ER shows that show us maybe a little glimpse of what the ER atmosphere might look like. And then I think that there's obviously the OB floor. Nursing looks different on that floor, where you have a bit of the emotional and family caring that you do. And so you're taking care of more than just a pregnant woman. You're taking care of her baby, but you're also taking care of her family. And so after she births her baby, you're making sure that all of her needs are met and that she's ready to take that baby home. On an oncology unit, I think that there's a different part of nursing that you're using there, and you're probably not using as much of that fast and furious sort of skill, but you're using an amazing part of your soul to encourage people along a very difficult journey. And all of them are important. I think all of us have different skills, all of us have different kind of gifts, and kind of learning what those are will help you in nursing no matter where you choose to go.
As a nursing student, I knew for sure I did not want to work in the emergency room. I wanted to work in the critical care area. So I worked in high dependency unit. That is a step down from ICU, and that was my passion. My advanced degree is in public health nurse leader. I did not do public health because that's what I wanted to do while in the hospital. I was looking at it as my future. Public health is the way to go. The aim, when you think about it, we've perfected nursing everywhere else, in the hospital, in long-term care, but we want to make sure that we can deal with preventative care. And I have a passion for preventative care, and that is in the community. So when I think about nursing is really a robust career or profession, I would say, because we are no longer only working in hospitals and doing bedside nursing. We can take care of very many different populations. You can do, if you don't want to work in the hospital, you can work in a home care. You can work in a nursing home. You can work in public health setting. You can actually specialize in IT, information technology. As a nurse, you'll be taking care of different populations in different settings, but the common theme is caring.